Hi, everybody. I hope you're all doing well. I wanted to share a few thoughts on probably a very relevant topic. Well, not probably for sure. Um, I say this, and the topic today being anxiety. I say this because as I've talked to all sorts of different counselors and parents, and um, over the years, the one observation that keeps popping up pretty consistently is that people are seeing more and more anxiety, if you will, in in frequency and in settings that we didn't necessarily see it, or saw it, significantly less. Um, and So I wanted to share some thoughts on that. Again, very relevant topic, isn't it? And it's a big topic, as are so many other things. Um, I have shared in previous discussions a bit of my own history, and part of that is that in addition to being a counselor, I'm also a sports coach, and I have been for many years, and and I like to think of much of the work that I do um, from that perspective, or at least it's a healthy, helpful uh, position to take, perspective for me to take. I enjoy bringing those two worlds together. And one of the things that I have appreciated about a sports metaphor and about being a coach is that the job of a coach, I have found oftentimes, is to be inviting people into different positions. When I look at a scoreboard and I see an individual or a team consistently not producing what they feel they could produce, they're having a losing seasons, or somebody's average just isn't what it should be. I know oftentimes it's because of the position that they've taken. And so my job as a coach is to help someone see the reality of the scoreboard. Usually they already see that quite well because they're the ones coming to me and asking for coaching. Um, my job then is going to invite them into a different position. I find this a very helpful perspective in working with families in conflict as well, um, because I'll explain it this way. The reason why people are in conflict is because one person has taken a position and another person has taken a position. So the problem isn't necessarily what they think it is, and that's the good news, because oftentimes the conclusions that people come up with from the positions that they've taken are no-win situations. All they can produce is a loss. And so this is why it's so important for me as a coach to be able to offer people a different position. Um, and so that's what I want to do here today around the topic of anxiety, because there's so many different positions being offered out there, and so much to gain from all these different positions. And yet, as I've said before in some of my discussions, I kind of want to take this discussion to a different level. Again, thinking about Einstein and him saying you can never solve a problem in the same paradigm in which it was created. And I've mentioned before some of my, I guess you could say, biases or observations that having been in the field and on the planet for quite a while now, I've been here long enough to see certain discussions happen over and over and over, certain lines of thought, certain ways of seeing things. It's kind of maybe a new and improved, or maybe it's the same discussion packaged in a different way. Um, and So I'd like to kind of push the edge a little bit on this topic of anxiety. And having said that, I personally as well have wrestled with anxiety for a great portion of my life. Um, for, I guess you could say, traditionally speaking, for many of the reasons other people would say they might experience some anxiety, and it has to do with the experience of trauma. Um, and my trauma, one of my traumas, I guess you could say, was having been given up for adoption, um, being placed into the care of the state, um, and becoming, I guess you could say, cared for by Catholic Family Services, etc., for a very short period of my life, and then being adopted out. Um, so, of course, traditionally speaking, even way back when I was born, back in the 60s, um, traditionally speaking, there was certain, if you will, deficits or challenges that one would experience if we had what might be called these days had experienced disrupted attachment. Um, Part of that disruption might involve feeling or having feelings of anxiety, what we would typically kind of diagnose as, in my case, a generalized anxiety disorder. So that's something that I guess you could say, wrestled with for most of my life. But back in the 90s, I, um, I guess you could say part of the blessings that I've had is that, that I chose to go into the field of psychology while at the same time, was very curious about my own state of being and my family, etc. So, kind of two birds with one stone there. I got to study what I enjoy, and I also got to find out more and more about myself, um, which took me into the study of transpersonal psychology, as I mentioned before, which is, again, that's a huge, huge field, an interesting title, um, but it kind of, I want to say, kind of introduces people or invites people into maybe a little deeper look into some things that brush up against different spiritualities and philosophies, etc. Um, so let me just say that I found some pretty significant relief in following those disciplines. Um, and I'm going to tie that in with some stuff around, around entitlement possibly today, but certainly I want to tie together at least two pieces, kind of, again, this traditional approach, and then there's a transpersonal kind of approach, and weave those two pieces together. Um, so So one of the ways you have to think about this if you're coming from a transpersonal approach on it, again, this is just a position. That's all it is a position being offered, um, is to set up a framework on which you see a human being as gifted, as innately gifted. Um, and I refer to this oftentimes, and has been referred to as the archetype of the golden child, or the immature golden child, what we might call infantile, or an infant. When we think about infants, the golden child archetype can be quite easily seen in terms of when parents, for instance, or a family become expectant of a child. Um, there's a certain amount of excitement and exhilaration that comes with the announcement of conception, and that a child will be born at some point. We call those people expectant or expectant parents. And one question that can be asked to clarify this idea is that what are we expecting about? What are you expecting to show up on the scene? Well, to make a long story short, you can see kind of built into the mythology around that is that there's an excitement that there's going to be something quite special showing up at some point. So special, in fact, that the adults, if you will, in often cases the community, is putting a lot of thought and energy into the arrival of this child, and making a home, and doing what's necessary in order to receive this child in a very grand way. Some of the names given to the golden child, or the qualities of the golden child, if you ask people what they're expecting, is you'd say, something like a blessing, um, innocence, purity, a bundle of joy, a prince, a princess, a jewel, an angel, ultimately a miracle. And so when you start to see all these words that we use to describe the infant coming into the world, we're really describing something quite golden, something almost messianic coming into the world. And that's the archetype of the golden child. So if you take that position, that there's part of who we are as human beings, that we're noble, that we're born of noble ancestry, and here we are arriving on the planet. There's an expectation then, as there would be of any nobility who's going to arrive, to be treated royally, to be treated divinely, to be treated with the utmost of care and sensitivity and consideration. We would probably say that on a good day, that does happen in the world. That's the key, really, to healthy attachment, is that there are caregivers who are willingly there, who do show significant amount of sensitivity, care, adoration, all that to the infant, and satisfy that infant's needs. When that doesn't happen, that registers as a trauma. Now, what does a trauma really mean? So I'm going to push the edge a little bit here. And I appreciate that I'm going to shortcut a lot of this, because this can all be broken down pretty significantly. But just to say that one definition of trauma, one position to take, is that it is an abrupt separation from expectations. An abrupt separation from expectations. You can think of this in a number of different ways, and I don't want to go into those too much right now, but just kind of let that sit there for a little bit and percolate and think about that. But if you take that position along with the position of the golden child, you'll see that there's a high expectation of the golden child, of this immature royalty, to be treated in a certain way. And when that doesn't happen, it's very shocking, very abrupt, confusing. One could say confusing, terrifying, hurtful, etc. So that can be kind of the beginning of anxiety right there. There's a fear story attached to that. Now I'm going to throw at you something quite new here, and I'll probably expand on this in other discussions. But I want to touch on this because in all my years of being in university and going to conferences and different trainings, I've never heard it described this way. And this is an insight that I had several years ago that I've developed more and more. And I call it trauma vows. Okay? Trauma vows. So whenever somebody experiences a deep upset, what we might call a trauma, something hurtful, people start to make promises to themselves. Now you can imagine some of those promises, if made by a child, are very, kind of rudimentary, very raw, very generalized, but nonetheless, they're there. And I've explored this so many times with clients, and it's always true, and it shows up in a lot of different ways. But just to say, that first story, what I call the victim story, which basically means, I had nothing to do with this. I was an innocent bystander in it. Something was taken from me abruptly that I felt entitled to. Now, I mentioned I might say something about the entitlement and indulgent dynamic. And I mentioned before in discussions that you also have to take the position to understand this, is that the core of who we are as human beings is this immature golden child, which is what we call infantile. The immature golden child feels highly entitled to be treated in a certain way. When that doesn't happen, it's like throwing gasoline onto the fire of entitlement. What you begin to see is magnified states of entitlement coming out of that. And of course, indulgence to follow. But that's kind of how that gets attached. Because the victim story says that I was highly entitled to something, and I did not get what I felt entitled to, or what I felt entitled to, I was robbed of. Okay? And so attached to that story, it's a tragic story, and attached to that is a significant amount of anxiety. Not only about what occurred, but about what might occur in the future. So this is how anxiety and our thoughts are attached together. The feeling of anxiety and worry is really about projection, isn't it? It's about projecting from what happened in the past as a possibility into the future, imagining that might happen again. And that can be triggered by all sorts of different things, right? We don't want to go into that today. But so a lot of times, traditionally speaking, that line of thought right there, that victim story, the wound, if you will, that wound will be explored. But there's a story that doesn't get spoken of often. Now, when we talk about trauma vows, think about it this way. If somebody broke into your home, violated your privacy, your space, your sacred space, violated that and took something precious from you. Of course, at first you would experience all that hurt from the violation, the confusion, the fear. Out of that, you would make a promise to yourself, of course, that you would never want that to happen again. But you see, that vow would mean nothing, that promise would mean nothing unless you had a plan. So that's where what you begin to see from the victim position, it's a defensive position. So you set up a lot of fences. I call them defenses. So you set up a lot of fences and barriers, and landmines and booby traps or whatever the psyche wants to set up there in order to not have that devastating experience happen again. So it's a defensive position. Now, once the smoke cleared a little bit, and your emotions settled down, you would also be angry. Whatever was taken from you, whatever you were robbed from, what was taken or robbed of, you would want it back. However, because of the hurt that still exists and the anger that still exists, this is not, as you would say, maybe an integral form of justice that one once served. It's more of a street justice. And especially if this is coming from the mind, if you will, of a traumatized person who is flooded with emotion, or a young person or a child, what it's going to look like is revenge. That the person wants back what was taken plus interest. So they not only want back what was taken, they want the person who took it to suffer like they suffered plus more. And that becomes the second vow. So the second vow is a revenge vow. Now, if this happens, especially to a young person, their vow for revenge, the question then is, how will you carry that out? How will you exact revenge? Well, you don't have a lot of resources at your disposal. And you have to also remember that the trauma vow, the first trauma vow, the fear vow, the victim vow, is not just, it can be composed of a number of other vows or sub-vows. For instance, someone might say, I promise myself that I'll never be hurt again. Or they could say, I'll promise myself that I'll never trust men again, or I'll never trust women, or oftentimes I'll see with clients where they feel hurt by both parents, if you will, and even by extended family, that no one came to their aid. So their vow is really against many, many people. So the vow really is that I'll never trust anyone again. And then there'll be a vow that kind of matches that one, which is For instance, I'll never trust anyone again. So therefore, the only one I can trust is myself. So you can see there'll be many, many vows set up in there coming from just one trauma, let alone repetitive trauma. And there can be grievances. There'll be grievances attached to all this that may be, maybe broad brushed on not just individual people, but on an entire community, on an entire family, or on everybody. So if somebody is, has some of that going on in their psyche, they're going to want to exact revenge on everybody. But yet, there's not a lot of ways to do that. But transpersonally speaking, there is one sure way to do it. One sure way that is under the individual's complete control. Because if you remember who the person is, at their very core, they are a gifted person. They are the golden child. Although immature, this golden child is incredibly gifted. Now, how this is going to work is that, again, you'll see a victim story on the surface, which is defensive. Underneath, you'll see a revenge story, which becomes offensive. So now the question is, how am I going to attack the people? How am I going to stick it to? How am I going to get revenge on the people who hurt me without being seen as the attacker? Well, the only way to get away with that crime is to wrap it in the victim's story. That's why you see the victim story usually showing up first. But hidden just underneath that, there's a revenge vow going on. Again, back to the fact that I have very little resources. I have very little avenues by which I can exact revenge. But the way that I can do it, the only way I can do it, is to withhold my giftedness. Because remember, everybody was expectant of me, highly expectant of me and my giftedness. Again, people would look at the infant and say, the infant represents new life, a new beginning, a great joy, all the things that would be so deeply satisfying to the soul of all people. So then what better thing to withhold than those gifts that these people would so enjoy? Now, just sitting under the revenge story, so you're going to see 3 vows. You're going to see a fear vow on top, revenge vow just under that, and just under that, you're going to see the sacred vow. Now, the sacred vow is an inscription written into the very core of who we all are. Remember, this is a position to take. It's a transpersonal position that says everybody is gifted, and everybody is also gifted in a way that they have purpose. And the purpose then is not to keep the gifts to ourselves, but to share them with the world. So there's a vow inscribed. You see, the first 2 vows are what's called prescriptions. Why? Because they are, if you will, man-made. Those vows, those narratives, I made up. The individual makes those up, or the individual may inherit those as well in more of a script or a role. But just underneath that, there's a sacred vow. So the first 2 are prescriptions. The second one is an inscription. When you think of inscriptions, think of something written in stone, something written in precious metal, crystal, what have you. When we see inscriptions, unlike the prescriptions, the inscriptions are a statement of what is or what will be. They don't explicitly say what will be done. The first 2 prescriptions describe a plan of what to do. The sacred vow does not prescribe what to do. It declares who the person is or what the person will be. and that is immovable. The first two prescriptions, the first two vows, must be, if you will, renegotiated. They must be challenged because they are both ultimately life-taking and not life-giving. The only life-giving narrative, which is really a mythology, it's a mythic declaration, is what is inscribed. Now, what is inscribed, of course, is not going to contain anything about getting revenge or about lacking anything. So the victim story is going to talk about how the reason why I am being this way, or the reason why I don't have a certain capacity, is because something was taken from me. The revenge story is where it gets really interesting. It's a difficult story to get to sometimes, but it's the one that frees the most, or almost the most. The Sacred Vow is the one that is ultimately freedom. But that revenge story is so important because that's also where the fire is. So to begin to gain insight into that story, which is going to be really part of a shadow aspect of the psyche, is really where there's some real power, because that one starts to put a person back into the driver's seat. It starts to say that the reason why I am the way that I am is because I am purposely withholding my giftedness. Now that vow, that story, causes a person to act in ways that are not a true reflection of who they really are, of their inscription. Now, when we act in ways that are not a true reflection of who we really are, when we act in ways that are not a true reflection of what our deep convictions are and what we truly value, guess what happens? We experience anxiety. Now this can sound, challenging sometimes to kind of get our heads around, or it can sound a little too transpersonal, a little too spiritual, but we all know this, don't we? When we do something that we know we shouldn't do, if we have an intact conscience, an informed conscience, then we will experience anxiety. And we experience anxiety until what? Until we confess what we did, until we become accountable and responsible. Now, for those people who don't want to go that path, which is the path of humility, guess what happens next? So if I do something that I know that I shouldn't do, that transgresses the truth of who I really am, and I experience anxiety, I can either man up to that, if you will, and account and respond, or I can kick in some defense mechanisms, can I? Denial, projection, rationalization, minimization. I can begin to use those defense mechanisms in order to not have to be accountable or responsible. Those defense mechanisms at that time also become indulgences. They're really just me lying to myself. They're just really a useful tool for me to live with myself. Because somewhere in my psyche, I know that regardless of what happened to me, that does not give me permission, that does not entitle me to violate my sacred vow. So what I wanted to point out here around anxiety is that there are kind of two edges to that. Now, a great part of my life I spent working on the first story about how I was hurt and what happened to me. Yet I still experienced anxiety afterwards. I experienced a decrease in anxiety, but my anxiety did not completely go away. Where I got a really big bang for my buck, if you will, where things really opened up for me and where things really began to open up for people, is when we begin to see that there's another layer of anxiety, and that anxiety comes from having made choices to violate our own sacred vow in the form of revenge. That we are withholding the very gifts that we came to give to the world. Now that, I always say to my clients, be careful what you ask for. Be careful what you wish for. If you want freedom, if you want to have that golden relationship, if you want to have that golden life, you're going to be refined. You're going to stand in the presence of a light, and this light is going to reveal something. And it's going to be a bit like a double-edged sword. It's going to cut both ways. But the cut that you're going to receive from having embraced this level of accountability is a healing. It really comes down to the old saying, no pain, no gain. There's suffering that we experience like a dog chasing our tail, or because we keep trying to solve our pain and suffering in the same paradigm in which it was created. Einstein said, no, that's not the way it works. You must go to a different paradigm. Let's have a different discussion. Because until we can have that deeper discussion about how we become our own worst enemies, we will continue to project that out on each other. We will continue to see divisiveness, division between, races of people, ethnicities, gender. Those are the discussions, folks, that I have been hearing my whole life. And they seem to still be going strong. And I suggest, as a coach, that we need to take a different position. We really need to stop projecting all this stuff out in a way that exacerbates pain and suffering. And we need to stop condoning it. We need to stop offering programs and things that support that. I'm not saying throw the baby out with the bathwater, that we don't, explore that victim story. I know it was helpful for me, but it wasn't the place that I was to take up residence. There was more to the story. And I suggest, and I've said this to so many of my parents who come into to my office and to the parent leadership group. Let's say, for instance, a parent might say, well, I'm anxious, I'm worried because I can't trust my kid. I say, okay, you say you're worried, anxious because you can't trust your kid. Because last time you did, what happened? Well, they did this. And I said, well, what did you do? Well, I screamed and yelled and, did my share of cursing and kicked him out of the house. I said, oh, okay, well, tell me, is how you acted and what you did a true reflection of who you really are and who you promised to be for your child, especially when they're in darkness and when they're confused? If I remember correctly, what your sacred vow said was something like that when they're in the dark, you will be the light, that when they're confused, you will be clarity, that when they're unstable, you will be the rock. Isn't that true? Isn't that your heart's desire? Isn't that really closer to what your sacred vow is and who you really are and who you really want to be for your children? Yeah, they'd say, yeah, you're right. Okay, well, then the way you just acted is completely the opposite. So really what you're telling me is that when things got tough, when it hit the fan, you bailed. You gave up on yourself. You broke your promise to yourself. Now, let's say, for instance, that your son or daughter also broke their vow to themselves, but they're only 14 or 15, and you're 50. So who do you think is going to be held the most accountable? Who do you think carries the lion's share of accountability and responsibility? Well, you do. Yes, they may have lost their integrity, but tell me, how far out of integrity are you? You're 10 times more out of integrity than they are. So tell me, really, what is the source of your anxiety? Is it what they did? Or is it the fact that, as you now say, you were being deeply untrue to yourself, that you broke your promise to yourself and your family? And now, to make matters worse, you're not even being accountable for it. You're projecting it on to your own flesh and blood, or a young person who's 15, 16, making them responsible for your lack of integrity. You see that betrayal, that self-betrayal, is significantly more anxiety producing than what the person did. In this case, for example, maybe the child came home late, maybe they smoked marijuana, whatever it is, and it was very likely, maybe that happened. There's no denying that. But what continues to happen, the ripple effect of that, is what the parent did, is what that person did. By what they did in the moment, how they responded to it, and by how they continue to use defense mechanisms in order to avoid accountability. They keep blaming their child for something they didn't do. They keep forcing that person, the child or whoever it is, to carry their level of accountability. And with every attempt to do that, that's another violation of the sacred vow, which is even more anxiety producing. So as you can see, this can be a house of cards that builds very quickly. And before you know it, you have somebody who's got chronic anxiety. And they keep looking outside themselves for the cure to that anxiety, but it's not the outside world. It's not the people in the outside world. It's the person. And there is a way to dismantle this house of cards. So I hope that made some sense today. There's no doubt it takes a pretty significant amount of maturity, amount of willingness to explore that revenge motive. But it is so freeing, I can tell you. And we all want to be free, and we all want our clients, our family members, our children to experience freedom. And this is what freedom is, especially, in the free world in which we live. We have the breathing room, if you will, to explore these options. And of course, these are all options, positions, realities, whatever you want to call them. They've all been around us since the beginning of time. We stand in the presence of great wisdom. I've always said the more interesting question is, as we stand in all this wisdom, why are we, pretending it doesn't exist? Why aren't we turning to it? Like the horse, that won't drink water. You can lead a horse to water. Well, hey, guess what? We stand before the wellspring of life, and, significant portion of us aren't drinking. That's real interesting why we would not want to do that. And it has everything to do with that revenge vow going on in the magnified feeling of entitlement and indulgence. Because tell me, what would happen to the horse if he drank? He'd be happy. But you see, the way that victim and revenge vow work together is that if the person quits getting revenge and starts to release the giftedness that they were once withholding, they would experience happiness. But on the other side of it, that means that the people who they had grievances on would be free as well. And the immature golden child has a hard time reconciling that. In other words, if I'm happy, that's great. But if I'm happy, the people who committed the crime are also free. And I can't have that. So in order to exact street justice on those who hurt me, I've actually got to live in a diminished state. It's a sad thing to say. However, we are as human beings very committed to our causes. Sometimes even if they kill us. So yeah, make no mistake, this is a kind of a deadly thing that goes on, and there's a lot of different manifestations of it that are really worth exploring. But it also promises great freedom. So yeah, it gives us a different position, doesn't it? A different way to look at what's going on in folks' life. So if people are living in a diminished state, let's say if somebody's marriage is, diminished, if it's kind of deteriorating, if somebody's health is deteriorating, if somebody's employment situation is, they're chronically unemployed, or if that's deteriorating, what would it be like to look at it from this position? Remember, it's just a position. That's all. Just another way to look at things. It's a different conversation to have. So I appreciate you hanging in here and kind of taking this little bit of a journey with me on this. We've covered a number of things. We've covered things that I usually have to cover within hours and hours of discussion and training. We've talked about the 2 ways anxiety can look. We've talked about the 3 vows, the 2 trauma vows and the sacred vow. We've talked about how entitlement, feelings of entitlement, indulgence are inflamed and magnified when trauma occurs. Yeah, don't let some of this fool you guys. It's wolf in sheep's clothing. Okay. So I hope that's helpful. Hope it gets the thoughts percolating, and I hope I can share more of this information with you, even in person. If you'd like like me to come and do a presentation or just have a discussion with your team or what have you, I'd be really happy to do that. And again, remember, this isn't the whole truth, if you will, if you want to call it that. It's a position to take, an angle to take that leads to a much different conversation, and it can lead to a lot of freedom as well. So thank you for your time, and you guys have a great day, and I'll be posting more. Take care.